Hello everyone, it's Dr. YouTube here. Thank you very much for watching my video. This video will all be about how to take a history and examine someone with a fracture. I think history is very important, so let's begin. In terms of taking a history of a fracture, it's important to first of all ask the patient, is it the right side or the left side? Because if you give the wrong side to the surgeon and the surgeon doesn't pay attention, then the wrong side gets amputated, etc. You don't want that to happen. Always get the side right. After that, it's important to take a presenting complaint, a history of presenting complaint. How did it happen? Was it a fall? Did the patient feel a pop? Was the patient able to carry out his or her normal tasks afterwards? So imagine yourself having a fall. What were the sequence of events? After that, take a past surgical history, any surgeries in the past, any past medical history. Past medical history is important because, for example, does a patient have any predisposing disease to cause fracture, such as osteoporosis, Paget's disease, or cancer, like myeloma or secondary cancers or metastasis. And it's useful to get a drug history and allergies, any family history, and social history, mainly what occupation the patient works in and whether the patient is right-sided, right-handed, or left-handed. So let's recap. History of a fracture. How did the patient fall? How severe was it? Was the patient able to manage his or her day-to-day activities after? After that, take a past medical and surgical history, focusing any predisposing factors to cause a fracture, such as Paget's disease, osteoporosis, or cancer. Take a drug history, allergies, family history, and ask what occupation the patient is in and whether the patient is right-handed or left-handed. The reason why we ask the handed is because obviously if the patient is right-handed and he's broken his right side, it's a bit more significant. I mean, any broken bones are significant, but for the patient's side of things. Now, let's go through examination of fracture. As with any systemic examinations, all starts with inspection. So, is the patient well or unwell? I like to go through, does the patient have any scars, swellings, or asymmetry? After that, after inspection, go for palpation. Go distally, feel for the capillary refill time. Is it long or short, more than 2 seconds, less than 2 seconds? What is the pulse? Is it tachycardic? Is he losing blood? Always check for the neurovascular status. It's very easily forgotten, but if you forget to make sure that they're neurovascularly intact, then, say they've broken a nerve and you've forgotten to feel for their sensation, then you're screwed. And the patient's screwed. Okay, so make sure you feel for sensation and the pulse, neurovascular status. It's important to feel for the joint above and below the area of concern because you can miss fractures, concomitant fractures that occur at the same time. For example, if someone's broken an ankle, feel for the fibula as well, around the knee area. Proximal fibular fractures. And finally, ask the patient to do some movement. So that's active movement. For example, if it's knee, do some knee flexion, extension. Perform passive movement. So in other words, you doing the movement for them. Is the patient able to weight bear? Do a few steps for them. And finally, perform special test if required. For example, if it's the wrist bone, feel for any scaphoid tenderness. Okay, so let's recap. In examination of fracture, look, palpate, and move. Look, is the patient well, unwell, any scars, swellings, asymmetry, feeling distally initially, feeling for a pulse, any neurovascular status, the any tenderness, any joint above or below, and finally movement, performing active and passive movement. So there you got it, guys. I hope you've enjoyed the video. Give it a thumbs up if you like, and share. Take care and don't break bones. Bye.